Thank you, Tanya. Just yeah, receiving everything, all the data that we had to process. It's a long process to do, and we worked really closely in partnership with BBF's data team. Dora, she is on this call today, and is happy to jump in to answer any questions that you all may have. So this that we are going to focus on today is the next family needs assessment that we will be doing in 2025. And we're really excited to announce our partnership with Rapid. And they are an organization that does a lot of these family engagement assessments nationwide. And this will allow us to have a lot more support in many different ways. And it's going to be a little different process. And so today we are going to go through what that process will look like. And we're really hoping to lean on you for your suggestions, any ideas you may have, any questions, and to just explain what exactly that process will look like. So we will go on to the next slide. Thanks, Tanya. So the agenda today, we're going to introduce Rapid, who they are, how our partnership will look with them, a project overview, what the project will look like, the content of the survey, and then we will have custom content options, which is new to this survey this year. Partner outreach, and that's where we will kind of recruit folks to participate in the survey, and then what the next steps after today will be to make this all happen. And now Katie will jump in from Rapid and discuss what exactly she does and where she comes from. And
Jen, appreciate it. Thank you all for being here. My name's Katie Nicolau. I'm a senior coordinator of the Rapid Survey Project, which is based in the Center on Early Childhood at Stanford University. And I'm here to share a little bit about Rapid and how we're excited to use Rapid as a tool to hear from more parents of young children in Vermont in 2025. So Rapid began in April 2020, right as the pandemic was beginning, as a survey of households who have at least one child under age 6. And it really was initially a tool to understand experiences during the COVID-19 pandemic. And Rapid has, from its inception, been a bit different in terms of structure. It's not just a one and done survey. It's an ongoing survey in the sense that we recruit participants through an initial recruitment survey. And if they consent to being recontacted, they will be reached out to in future months directly via email for more survey opportunities. So in that way, we can track some trends about how families are doing over time, as well as add in to those monthly ongoing assessment surveys some more timely questions, depending on what might be going on in the world or special topics of interest. So after the National Household Survey launched in April 2020, we added a parallel National Child Care Provider Survey in 2021, which I won't talk about today, but just wanted to give you that context that we also survey child care providers. And we see both of these surveys as tools to elevate the voices of adults in young children's lives and provide timely and actionable data to promote data-informed programs, advocacy, and policymaking. So we, in the past almost 5 years, 4.5, almost 5 years, have surveyed over 20,000 parents and 7,000 plus providers in all 50 states. And all of our surveys take about 15 minutes to complete, and participants are paid a $5 gift card for each survey they complete. Finally, the surveys are online, so they can be taken on a computer, a smartphone, or a tablet in English or Spanish. So I want to say before we move on to the next slide and get into some of the survey content, a little bit more about the structure of the rapid survey, because I know the ongoing nature of the survey might be a little bit different. So as I mentioned, we recruit parents with young children under age 6 through that initial recruitment survey, and that really collects basic information, which we call our core items, which I'll go over a little bit next. And also, importantly, participants completing that initial survey gives us permission to add them, if they give us permission to add them into our ongoing participant pool. So every month after that, we select a representative sample of about 1,500 participants across the country to take that ongoing assessment. So the ongoing assessments can be used to view a snapshot of how families are doing on a monthly basis. And as I mentioned, participants who do opt to participate in the survey on an ongoing basis, they may receive an invitation every month, or perhaps it might be a few months between when they receive another survey invitation via email after they complete that initial recruitment survey. So on the next slide, I'll go into the survey content. Thank you. And over on this slide, I wanted to just describe some of what we call our core survey content. So these are themes or topics that we are asking questions about in every survey, whether it's a initial recruitment or ongoing assessment survey. And the first is demographic information. We ask for a few pieces of demographic information, including state, phone number, email, zip code, and month and year of birth for the participant. Then the reason we ask for those pieces of information is because first of all, for email, all of our gift cards are distributed via email. So we need a valid email on file to share that gift card with once the survey has been complete. And we also, since it's an online survey, it's not uncommon for robots to get to the survey link and take it. So we need a few pieces of information like first and last name and phone number to be able to verify that a participant is a real, authentic human that is trying to take the survey. And we have some other strategies for trying to keep robots out of the survey too, but I won't go into that too much now. And finally, the reason we ask for month and year of birth is because it's very important that our participants are over 18 years of age. So we need to verify that. Our other topics, core topics, include material hardship, which we define as difficulty paying for at least one area of basic need, including housing, utilities, food, healthcare, childcare. So we have parent and child well-being as well. We want to check in and see how parents themselves are doing and how they are perceiving that their children are doing. We want to know about their childcare experiences. What care, if they're using childcare, are they using? How is that going for them? How many hours per week are they using childcare? What type of childcare? All of that. And healthcare as well. We want to know about parents' access to and use of healthcare. And finally, we include in every survey some open-ended questions, so we can also collect qualitative data. So a lot of times those are questions like, how is your family, or is there anything else you'd like to share about how your family is doing right now? And I'll actually soon share a few responses that I pulled out to give you kind of a preview of those open-ended questions. But so each survey includes a set of these core questions from these core domains that we ask repeatedly to gather longitudinal data. And then, as I mentioned before, we also include modules or sets of questions that can be inserted into any of the ongoing assessment surveys on a rotating or more occasional basis so that we can capture insights into specific topics that, as I mentioned, could be more timely. For example, around this time last year, we were asking families about the news that the student loan payment pause had ended and how that was affecting families, kind of as an example of a timely topic. So on the next slide, please, I'd love to share some quotes that I pulled out from our sample of families actually from Vermont. And this can give you a preview of some of those open-ended questions that we ask in the survey. The first one being, what are the biggest challenges and concerns for you and your family right now? And a participant in Vermont said, making it financially is our biggest concern. Our second concern is ensuring quality education for our special needs child. Trying to get caught up on our car payments is causing a lot of stress for my husband and I. My husband and I are separating, so figuring out how to get my own SNAP card, navigating divorce, etc., and keeping consistent childcare. When we were first looking, we had someone back out on us, and recently we had to change childcare because her current provider was moving. It's a struggle to keep childcare that we can actually afford. And then I thought this next question would be nice to include too, some of the more positive aspects of what families are experiencing in response to the question, are there supports or services that you currently find most helpful for your family? A parent in Vermont shared there's a family center here that helps with diapers and household items. They help us a lot. Connections and relationships built through church, homeschooling groups, going to the library for play groups, and tons of books, etc. So just a little sample of some of those qualitative data we gather through the open-ended questions. Next slide, please. I also wanted to share how rapid data are used. So even though for this initiative, working with you all in Vermont in 2025, we'll really be focused in partnership with you on hearing from families in Vermont. This is a national survey, so those responses that we receive from families in Vermont could be used in some of these ways as well, which include regularly published fact sheets on our website, which I can put in the chat, is a tab where we publish fact sheets about every month. And you can see on the top two pictures some of the topics from recent fact sheets that we've published. Parents of young children are concerned about access to food. Postpartum parents' emotional well-being and physical health affect their caregiving abilities. RAPID's findings are also often picked up by reporters and the press and highlighted by our partners in their own publications. You may be familiar with 0 to 3 State of Babies yearbooks that RAPID has contributed to in the past, or in other blogs or editorial pieces. So there's some snapshots on this slide of some of those recent headlines here. And finally, another way that rapid data are used are in cases when findings from any of these publications or from our survey are mentioned or referenced in discussions and presentations about national, state, or local policy. So there are many different ways that the data are used, and just want to underscore that we take protecting participants' privacy very seriously, and all of the information that they share in the survey is protected and stored securely, and no identifiable information is ever shared. And there's a statement communicating that to participants at the beginning of the survey in the consent form. And they can also even opt out to have, like, for example, their open-ended responses shared in quotes or presentations like I did here, if they would prefer not to. So one other thing that I'll reference before the next slide is when I put the link in the chat as well to our website, we also have a newsletter, which is something you can sign up for if you scroll all the way to the bottom of our website. It goes out monthly and is another way for both partners and survey participants to get updates about the data that we're collecting, the findings we're publishing. We often share resources in the newsletter, so that might be something of interest to kind of keep up with Rapid, if that is of interest. So quickly, I'll just put that link in the chat to the website before I forget. And I think we can move to the next slide, which is my final slide. Great. So this contains some important information about who's eligible to take the national survey of families with young children. And these are questions that the participants themselves answer at the very beginning of the survey. And if they answer no to any of these questions, then they are redirected out of the survey because therefore they're ineligible to participate. So a participant must be a primary caregiver with a child, at least one child under age 6, who spends at least half time a week with the child. And the participant does not have to be a biological parent. Participants need to speak English and/or Spanish, be 18 years of age or older, live in the United States, and consent to being recontacted via email for those ongoing assessment surveys. So I think that's my last slide, and I'll pause there, I guess, and see if there are any questions, or maybe we want to save questions for a little bit if you have more to share, BBF team.
Yeah, we can pause for a moment for any questions for Katie. We will be going over, like sort of reviewing and going over some of the details in the upcoming slides. There was one question in the chat related to helping get answers for parents that might have barriers. I don't think we have a concrete system in place yet, but what I will say is that we are talking with some partners who do some direct service with families that may have barriers to completing the survey, and really leaning on those folks to how we can support them in supporting their families that they work with in filling out the survey. And we're certainly, open to ideas and working through those details with Katie and the Rapid team, is how we can reach the most Vermonters, and particularly those that might have challenges or be in underrepresented groups.
Yeah, and I can say a little bit more about that too. And we do acknowledge that an online survey is not accessible to everyone, and are actively working in some of our other projects to learn about how we can potentially implement strategies like interviewer assisted surveying in the future. But right now, that's not available on the national survey that we're here to talk about today. So it's something we're aware is a need and are trying to figure out, but currently do have some limitations in that way. But we do strive as much as possible to make the survey content itself a lower and accessible reading level, and to make it no more than 15 minutes, as I mentioned, so that it's not overly burdensome for families. That's our intention. So we can continue to keep you updated on any updates in that area too, but know that it's something that we're definitely mindful of, and trying to work towards within kind of the limitations that we have, work at being needing approval from an institutional review board at the university and all that.
Thanks, Katie.
So looking forward, what the plan is to start our initial recruitment in January of 2025. We'll send out the first recruitment survey with the help of our partners here. Anybody who's willing to help us get this out into families who would be eligible. Parents and caregivers will only need to fill out that initial recruitment survey once. But there will be an opportunity to send out that recruitment survey multiple times over the course of this project from January to June. There will be new recruitment survey links each month, but a family will only need to fill out that recruitment survey once. Once they are enrolled in the Rapid system, they will receive emails directly from Rapid once a month, or possibly once a month, or possibly less frequently, depending if they are selected each month or not. And we will ask our partners and BBF staff to help with sending out that recruitment survey, new recruitment survey every month to capture new families at that time. So along with that recruitment survey, there'll be links to fill out the information, language, everything to include in either a newsletter, an email, parent group. The only thing we're asking is just to not share over social media because, as Katie mentioned, we are trying to avoid as many bots getting into this project as possible. So on this slide, what we've done is we've compared the typical language and questions from the rapid survey to our 2022 family needs assessment that was written and put together by this committee and BBF to try to make sure that we had many data points overlapping, that we could compare the data to past data that we've received. So these are the kind of areas that we are seeing the overlaps. This includes information about parent and child well-being, child development. Those are things that we are hoping to get new information on. That was something that was flagged during our 2022 family needs assessment, kind of missing out on that mental health, mental well-being aspect during our survey. So we're excited to see those things included in the rapid survey. So we're just going to take a moment here to kind of review this comparison sheet and open it up to the floor to answer any questions that you might have about this content. Yes, Ali.
Thank you, Sarah, and thank you, Katie, for the presentation. And I wanted to just circle back about the discussion about the lack of inclusiveness of this survey to some communities. And also to ask you a question about, have you conducted such survey in, similar state with Vermont size? And were there only the English and the Spanish? Was it only available to that? That's the first question. And the second question is, knowing that this is for a project of 6 months, right? We know, are there opportunities to at least change the process in order to include other communities? One, about the online survey, right? And two, about the language. Are there opportunities to alter your plan and to be able to be inclusive in the state of Vermont? Because we have a strong concentration of newcomers here, and these questions are so important, and it will be a disservice maybe, to miss those viewpoints as well. Yeah.
Thanks for that question. Yes, and totally want to work with you all. And I know on behalf of my team as well, that we are eager to make the survey as inclusive as possible. Currently, it's only available in English and Spanish, this national survey. And that's been the case for the past few years. We added Spanish soon after the launch of the survey back in 2020. And some of Rapid's other surveys, we do some more local community-based surveys that we have been able to offer in other languages, but we haven't yet been able to implement that structure onto our monthly national survey. So, and I will offer some context as well about this partnership with Building Bright Futures. As I've described, Rapid's a national survey, and typically we don't recruit participants at the more local state level for this survey. Our typical recruitment partners are organizations that work directly with families and childcare providers nationwide. So this is a pilot approach for us to learn about how we can use this national survey structure to help meet more local data needs using our current team's capacity and resources. So we really want to take in this feedback during this 6-month pilot to know what is working and could be better, so that if we are able to continue to use the national survey to help meet local and state data needs in the future, that we're being responsive to those needs. But I am not sure about, it'll depend over the course of the next 6 months or so, how responsive we can be in those 6 months. Like, for example, I don't anticipate in the next 6 months that the national survey will be available in other languages besides English and Spanish at this time.
Ollie, I'll just add in that we did have some discussion previously about the opportunity of maybe bringing this to communities via bringing it with an iPad and having it filled out in a group setting. So maybe we could explore that option with offering interpretation services at the same time as presenting this survey. So as we come into our discussion around recruiting our partners to help us get this to families, we'd love to kind of get some ideas about bringing it to Dabble Days events or other winter social gatherings where families are brought together, and trying to get to families that maybe do not have internet access to receive this or have language barriers. So lots of ideas, but it's definitely an ongoing struggle in Vermont that we are aware of, right?
Thank you.
So I want to make sure that we're doing the best use of our time here. Just kind of going over, since these are the questions that are pretty similar based on what we've asked of families during past surveys. If anybody has any specific questions about this slide, or we can move on to kind of the discussion around some custom content that we might be able to add into this survey to address issues that we are seeing within our Vermont families specifically. So I'll give it another moment here before asking Tanya to move on. I see a question in the chat from Katie saying, do you partner with any homeless resources or agencies?
Katie, I would say to that yes, we would like to, and we'll be looking for some suggestions from the group in just a few minutes.
Yep. And are there maybe any questions about sense of safety and sense of belonging? Do you feel that you belong in the community where you live in? Do you feel like you're safe? Yeah, you have those type of questions.
Yeah, thank you for that question. Not that I know of, but we're learning about what can be included and learning about the options. And so with that, I'll move to the next slide. So, as we've said, we're going to be following the rapid household survey, right, which covers the topics that were just on the previous slides. There is some potential to add some customization. To do that, we would pull blocks of questions or groups of questions from an existing question bank that Rapid has available. So this is the place where we could add some content to meet Vermont needs, to strengthen what's in the existing household survey. So what you're seeing on the screen are the content areas that we have the potential to add to the Vermont survey that will go out. So I'm just going to give you a moment to kind of take a look at these and start thinking which topics you think are the most critical to understanding Vermont family experiences at this time. The opportunity, there's a few ways to do this. There are some options, like we could potentially pick one topic and have that included in every survey that goes out in the 6-month period, or to choose a few and do a little staggering, do a little design so that they're included over the 6 months. We're waiting to decide how to do that until we hear from all of you, from everyone in our network. This is really what we want to hear from everyone on this call. We're going to follow up this meeting with some personal outreach to partners and organizations, and really give folks the chance to weigh in on what would be the most critical to add to strengthen the household survey. So what we're going to ask today is take a look at this list and the descriptions. And we're going to use the chat to allow you to let us know what you think are the top three options or choices from this list. And certainly during this time, if people are putting those ideas in the chat, you know, feel free to raise your hand too if you have any questions. You know, as you can see from the first two, there's some space. You know, Katie spoke to, you know, like the financial hardship piece that's included in the survey. You know, there's some questions around, further questions around financial strain and the impacts of inflation that could be added to go deeper there. As well as, you know, around debt and overdue bills so that we could get further into financial strains. There's some information, there's some questions related to paid family and medical leave related to the access and use of that we can learn about. There's some questions related to just working parents that gets into sort of the work productivity as a parent, and the types of benefits and assistance that workers are receiving from their employers. There is the childcare block that's included in the household survey. This infant and toddler care is a specific set of questions specifically related to that access of infant toddler care. There's a few options, as you see here, social determinants of health and special specific needs, where we could narrow in on supports and services related to physical health and safe outdoor spaces, or, you know, related to special and specific needs about supports and services for children that have special needs. And there's the block on pediatricians about experiences with your primary care physician, and parenting stress, where we could add more questions to get a little further into parent health and well-being. So again, please let us know in the chat what your top three are. If you need time to think about this and still want to weigh in, we also invite you after this meeting to either connect with myself or Jen and Sarah and share your thoughts. We'll be gathering this input over the next couple of weeks. And then deciding based on what's elevated and what's voted for the most. And, you know, we'll weigh all of those features from what, factors from what we hear from our network to figure out the best direction to go in, to learn as much as we can about Vermont families. You know, again, the capacity to be able to reach families over a 6-month period and get that over time information, I think is going to be really impactful. There's a lot of potential here to hear really impactful stories of access and challenges and the opportunities. Great. Thank you for all of these comments coming into the chat. And again, we will send this out. We'll send out the recording of this meeting afterwards. And, you know, we welcome you to email us or contact us if you have more thoughts and input. I'm just going to give everyone like one more minute because this is a lot of information on one screen. does seem like lots of folks have had a chance to weigh in. We really appreciate that. We need all of your input to decide on the direction to go with this.
I did list them out in the chat if it's
Oh,
easier
thank
for
you.
folks to just put in numbers, identifying one being financial strain. So just another option as well, or for you all to
That
save and kind of think about it at a later.
was a great idea. Thank you, Jen. Wonderful. Great. Okay, I'm going to move to the next slide. There's one more place related to sort of outreach and who to connect with. You know, we want to reach 1,000 families. Like that's sort of like, I don't know, a benchmark of receiving a really good amount of responses. And we need our partners and our network to help champion this effort, right? To add it to newsletters, to add it to, you know, communications with Vermont families. And so we put together this list of, you know, our first thoughts on who's going to be really critical to help us reaching Vermont families. And now we're asking who else, right? Like, who else should we contact and ask for their partnership in distributing this survey over the 6-month project? Who might have really good newsletters and communications that reach families, or groups, you know, that we're missing, underrepresented groups that we might be able to access with some great partnership. So again, you're welcome to either raise a hand or
I'd
put
just like to
something in
jump
the
in,
chat.
Tanya, and remind
Yes,
people that
please.
we're trying to reach families with children ages 6 and under, which is different than our usual BBF goal of ages 8 and under. So like my initial thought is like, oh, elementary schools are missing from this list, but that kind of is out of the age demographic that we're looking for. So just a
Mhm.
reminder there. I also wanted to mention, it made me think when you brought up the 1,000 families that I think when we did our last family needs assessment in 2022, we had over 400 responses during the 1 month period that we were sending out the survey. So it seems like a real big ask, but if we got 400 in a month, feels like we should be able to reach 1,000 over 6 months. So it feels exciting.
And again, to reiterate what Sarah had mentioned earlier, we prefer to avoid promoting this survey via social media just to prevent bot responses. We're not completely opposed to the idea, but if we can get it out using these other networks and really try and focus on using the support of folks who really work one-on-one with families, that would be ideal. But again, who would you want to participate and ask? And Ali, you touched on that a little bit earlier. What communities do we want to reach, and how can we reach them? We'd love to hear any ideas that you have. Again, Katie mentioned this is a pilot, having it be statewide instead of national for them. But a lot of folks on this call, we do have experience with the 2022 and the 2020 family engagement, family needs assessments. So how can we use our experiences from those and kind of combine them with the support from Rapid to get a really good outcome from the survey and hear from as many Vermonters as possible?
These are great suggestions in the chat. I'm just looking through them all.
Also, folks can feel free to unmute and chime in and ask questions. This can be an open discussion at this point as well.
Yes, to your question about the communities, I think we have started project, Anna and Tanya. We met with a couple of the 3 communities we want to reach about the survey. They had some questions that they captured. And yeah, I think we will try, but we will see with the time.
Mhm. Thank you. These are great suggestions, and um, having a really long list of people to do outreach with is a really great problem to have from a from a workflow point of view. It's a really great problem to have, and exactly the problem we want to have is have so many people that we need to be connecting with. So thank you. Again, please feel free to keep sharing. We're always open to input. We just wanted folks, to sort of end with what we were thinking are the next steps, right? Over the next month or two, we really will be taking all of these ideas for partner organizations to connect with, and sending communications out to those people and across just the BBF statewide network. January, oh, I put 2024, guys, look at that. Oh my gosh, I am so sorry. Not ready to change years, but in January 2025 is when, as we said before, the first recruitment survey will go out, enrolling families, and first survey requests will be sent to families via email. And then from February through June 2025, the outreach will continue, right? We'll connect with partners and say, here's the link for the, for example, for the February recruitment survey. If there are more families that haven't enrolled yet, please include this in your newsletter and communications so that recruitment continues through the 6 months, as well as those families that have already enrolled will continue to get the household surveys from Rapid. And then once we get to July of 2025, the Vermont data will all be put together by Rapid, shared with Building Bright Futures and the Families and Communities Committee. We'll look into analyzing that data and finding the best way to, put it in a report, create an information summary, and we'll probably host a webinar similar to this one where we invite folks in to share what we learned over the 6-month period, as well as share how, our hopes for elevating it through our network and to system leaders and the legislature moving forward, so that we can use all of this great information from families to improve programs, practices, systems, services going forward. Katie, thank you so much too I'm just reading your comment. Always worrying about the people trying so hard to survive that they don't get a chance to voice an option. We really worry about that too at Building Bright Futures, and really hope that we can find ways that partners will support and help us make connections so that we do reach as many voices as possible. I'm going to pull down my share.
I think one way we may be able to help support that is by offering the $5 gift card for families that do fill out the survey. And that's, it's not everything, but it shows that we do value family voices and the time that parents take to put into this. But if there are any other ideas as to how to support and reach out to those communities and those folks, we'd love to hear it. And also the way that we are kind of conducting this survey is very different from what we've done in the past and is quite confusing, or can be quite confusing. So if anybody has any like clarifying questions that they want to ask, now may be a good time while we have Katie from Rapid here, and also Dora from our data team, myself, Tanya, and Sarah. So feel free to chime in and ask questions or give any ideas you may have.
I just wanted to add one thing, Katie, in response to your comment in the chat too about trying to reach families whose voices might not be coming through as much as others in the survey. And something that is, again, not everything, but something we can do a little bit more of perhaps to meet those families where they are is maybe having like a shared device, like a tablet at places they're showing up to, and giving them an explanation, a short explanation about the survey, and giving them a chance to take it if their time allows in that moment. And one thing that from a data cleaning perspective, we just would want to work with you all on, if you're interested in doing that sort of recruitment, is let us know if you plan to use like a shared device like that at an event or at a specific location, because when we're cleaning data, we look to make sure that IP addresses aren't showing up as duplicates. So we would want to know, have that context that that is not a source of concern with that specific source link. And we can answer more questions about that later, but just wanted to raise that option.
I was going to chime in and add, I wonder whether having opportunities, particularly for populations or communities that will have a harder time accessing, if there is a way to like join an event that also, we've talked about it in other contexts of added value. Like if they're already there for a reason and we can offer them this other opportunity, that we might get more voices. The other question I had was when people get the link, I guess, will it be clear that it's coming from BBF, or will it look like because I tend to kind of discard big national survey things. I tend to look for things that are more local. So is there a way to make it clear that this is linked to and the data and information will be used locally as opposed to just a kind of big, broad national thing?
The links typically will be coming from Rapid, but Katie, if you want to chime in to see if...
Yeah, that's a good question. Typically we have, well, so since it's organizations that are working in Vermont that will share the link, you're free to add any sort of language about the survey and how the data will be used that feels right to you and your outreach. But the link itself does take participants to our Qualtrics account, which is a Qualtrics page. Qualtrics is a survey software and it is branded with like Rapid at the top. But I could see if maybe we could add in for participants that are going to be taking the survey like from one of the links that you are all sharing, if we could add in like a special page or something that has a brief note about this specific effort in Vermont, or the logo or something like that. So let me make a note of that and look into seeing what we could do to make it feel a little bit more familiar to folks.
I think part
So-
of like for myself as a parent, like having the context or having the warm handoff, right? Like if it's coming through my childcare provider and they're like, here's the reason why, and then it takes me to somewhere else, like, or we're partnering with. I think that is like this, why this big list is so important. And it's not just sort of this random, thing coming to me, but it's something that my childcare provider or my pediatrician or you know, however many of these other, or a play group or a library is saying like, this is something that we sort of trust and we think is a good idea and would love you to participate in. I think that those sort of, yeah, warm handoffs, warm introductions are always appreciated.
I really love the idea of trying to identify it as a Vermont collaboration with Rapid, though, because that warm handoff, you're right, but then you take the recruitment survey in January and you don't get a survey until March. You've forgotten about that warm handoff because you're a parent and life is chaotic. So I think that that would be really neat if there was maybe some language that we can include in the email, or some way to include like a welcome loading page before starting the survey. If possible. Makes a lot of sense. I think that's probably one of the things that was so successful with our past family needs assessments, is because BBF kind of recognized that parent to parent connection is so successful in getting families to engage with these kinds of things. And we had individual parents out there recruiting people to take the survey, sharing it locally within their systems, with their friends, with their childcare providers, et cetera. So I think the big ask, I'm really excited about this opportunity and the ability to maybe reach a lot more of Vermont, but then you are losing a little bit of that more interpersonal connection. So I think the idea of bringing a tablet to a library story time or something while the kids are reading a story, asking the parents, hey, you want to come over here for 15 minutes with me, could be a great opportunity for that as well.
Well, thank you, everyone. If there are no other further comments or questions at this time, we've made it through all the content. We did schedule an hour and a half and thinking, oh, maybe we can do this in an hour, but didn't want to limit if we felt like we had more questions to answer or discussion to have. As we said previously, you can expect to get emails from the Families and Communities Committee with the recording and more information and communications to come in the upcoming months as we prepare to launch and get this going in January of 2025. Thank you so much to Katie and the Rapid team, and Katie for being here with us today and sharing so much information and expertise with us. We really appreciate it. We're really excited.
Thank you all for being here. Excited to work with you all and hope you have happy holidays.
Thank you, everyone.
Thank you. Be well, everyone.